Uh, yeah, this long span old bridge was removed already, and after anesthesia, Dr. Zhang made a Crestal incision with number 15 braid scalpel. For this Crestal incision, as you know, the upper jaw case, especially upper anterior, upper posterior also, a little bit palatal, the inclined incision is better to flap management. For me, actually, from mid-crest, about the 2 millimeter, the palatally inclined, moving to palatal, and the deviation, the crestal incision, was made always. Okay, and after make of crestal incision, flap reflection was started using peristal flap, a peristal elevator. The palatal flap, generally speaking, as you know, the palatal flap is thicker than labial. So, if possible or if necessary, you can use this little bit thick, the palatal flap. If you want to have the connective tissue graft, you can harvest soft tissues from this palatal, the soft tissue zone. Now, using the round shape, the curette was used for the elevating the labial side flap retraction. So, what about this area? Number 21 side, actually very thin narrow bridge, right? So even though the top portion looks like a little bit wider, however, just underneath this area is extremely narrow, right? So it looks like a little bit the mushroom style, the rich shape. So you have to always checking all the ridges shape. And this ridges shape already informed from CT view. However, after flap reflection, you have to check with instrument manually. And yeah, number 11, 12, 13 area also very narrow ridge here. So this area is impossible to have an implantation. Or another big more surgeries like titanium meshes or some tenting screws for the GBR procedure to making enough space making. And there are many difficult procedures are necessary if you want to have an implantation or a bone grafting GBR procedure on this entry area. However, today Dr. Zhang is showing us about the simple bone grafting on this extremely narrow ridge with implantation, with the strategic, the positioning implantation. So, very clever approach for this elder person. So, let's see. Okay, after flap reflection, now we made the crestal incision and the clavicular incision, and just reset the vertical incision here, and checking the proper position, and using high speed, a small round bar to make a position for the initial drilling on number 21 area. Okay, this area is 14 area actually. The long span situation, as I mentioned before. So what to think about this high-speed bar usage? Sometimes we're going to use this style, a small round bar to make an indentation. The narrow ridge case actually thick the cortical plate, the top portion. So instead of this procedure, just using the initial drill, like a Lindemann drill, even though the Lindemann drill first on this area, the top cortical plate makes some easier slippery during the drilling. So preventing this kind of discomfortness, Dr. Zhang used high-speed bar first, and then Lindemann drill using for making proper the osteotomy with proper depths. I think almost 11 millimeters. The place of a parallel pin here, two parallel pin, checking pass, and angulation and distance from neighbor teeth. The all of three-dimensional position was evaluated on this step, right? The final aim, the final purpose of the implantation is make a new implant-supported prosthesis. Make a new implant-supported prosthesis, right? So the positioning is important as well. Okay? Just the initial drilling, just only two drilling, right? And then the placement, diameter 3.5, undersized drilling was achieved, right? And until 3.0, final drill, and then go 3.5 diameter cause of this soft bone quality. Final drill here. This final drill have a Lindemann type. The final drill have a Lindemann style shape, so efficient to have osteotomy with the proper positioning, right? So nowadays, we have three different types of final drill kit available. 3.0, 9 millimeter, bright TL was inserted, this number 14 area. Okay, hand ratchet was applied to make more insertion of this fixture into the osteotomy site and get the proper depths. Good. Actually, at the bottom of this, the angle, the bevel portion, that is the same level of bone crest. Remove the plastic cap. This plastic cap, the working as a protector on the screw thread, right? And connect with the scan comfort cap. This scan comfort cap working as healing abutment first. Second, working as scanning jig. Third, working as a dual abutment like function for the combined with the temporary prosthesis, PMMA temporary prosthesis. Can you see the notch? These notches for the scanning, right? All the procedures was done with a simpler way. Now, checking the pass and clearance. Okay, now 200 RPM with harvest drill. This harvest drill designed for the harvesting autogenous bone around the surgery area. So 200 without saline irrigation, just 200. The clockwise angle direction, and we can harvest this autogenous bone from neighbor area. Looks like here, the very simpler way and efficient way to take autogenous bone, right? So this autogenous bone was achieved once more using this harvest drill, 200 RPM without saline. All of this autogenous bone, the promoting a brand new bone formation, as you know. So I think Dr. Zhang is at the xenograft, the top portion of this, the outer portion of autogenous bone area. Okay, so filled with osteon geno on the harvesting area. So osteon geno, as I mentioned before, as I informed you before, this bovine bone from the cancellous, bovine cancellous area. The source is bovine cancellous. So little bit faster the turnover rate. So the resorption time is faster than the bovine cortical. And it means the faster bone formation, the brand new bone formation was the faster made than the just cortical, the origin, another brand, the bone graft material. Nowadays, actually, I prefer use this osteon geno, and I want to use xenograft material. So what do you think about this absorption, the blood absorption rate? This osteon geno have lots of the pore. The large pore and micro pore is well organized and well synchronized and harmonious. So the faster bone, faster blood absorption. So faster soaking. It is the essential properties of bone graft materials to make a new bone. Wow, very nice and perfect. The bone, the qualities, bone graft qualities. So the packing, a little bit dense, the packing around this implant fixture. The ordinary 2 millimeter of the bone from the outer surface of implant fixtures is a necessary part to make a long-term, the successful, the result. That is very general principle. So 2 millimeter bone is a necessary part from outer surface of implant fixture, especially on this anterior is important factor to maintaining well conditioned after insertion of implant fixture. So this autogenous bone first and the xenograft outer surface, and finally we're going to make the minimum 2 millimeter, the sustained on this area. Now, the interesting situation, normally, the previous procedures, the collagen membrane was applied for the GBR procedure to maintain space and to give us stability and the security. However, this time, Dr. Zhang is going to use collagen graft instead of collagen membrane. Why? This collagen graft is better, much better to have a soft tissue healing, right? So if you want to have a faster soft tissue healing, you may use this collagen graft. It's better. The collagen graft have the unique properties that initiate epithelialization and the connective tissue cell migration. So finally, we can see the faster soft tissue healing. And actually, as you know, this collagen graft have two different layers. Outer dense layer, inner coarse layer. And that is a good favor to make a new bone formation when I use this collagen graft. Okay, so simple procedure, right? Okay, that's done.